Hello, everybody. Good afternoon. Hope everybody's doing okay. We'll go through the data, then just go through a couple updates on vaccine and other relevant questions. Unfortunately, we lost two members of the community over the last 24 hours. Female, 75 years of age, and a male, 82 years of age, both in hospitals. This brings our total to 649 of our residents we've lost over the course of the pandemic. Obviously, very sad, and our thoughts and prayers are with the families of the loved ones and everybody who's been impacted during the pandemic. Our 7-day rolling average holding strong, 1.6%. So essentially, it's been 1.5 or 1.6 for I think about a week now. That's important too because all of our new cases reflect colleges. So I've had that question: do our new cases reflect higher ed? They do. Obviously, there was a couple missteps with some of the students at Syracuse University that have been reported on that have led to cases. So, but again, overall in the community, we're doing well with new cases. We've had 30,757 positive cases since March 16th of 2020. That's 75 new cases. So 75 new cases over the last 24 hours. 899 active cases right now. That number got down into the 700s last week. I think we'll see if we can get there this week as well. 3 cases from senior facilities out of the 75. Percentage-wise, it's been about where it is, been under 5% almost every day. Why we track that is there's a direct correlation with our seniors from congregate care facilities when they become COVID positive into hospitals, into the ICU beds. So we watch that, and obviously the fact that we went from dozens of senior facility cases down to a handful is very good. We now have 93 individuals that are in the hospital and 17 in the ICU. Please keep those folks in your thoughts and prayers as they obviously need them right now. We need to get them home and get them well. Looking at the vaccinations, we received 1,900 doses of the vaccine. Confirmation, that's more than the 1,200 last week. 700 out of the 1,900 specifically for comorbidities. And so that's good. We got more vaccine. That's a range where we can start to have an impact. We saw new appointments at the fairgrounds over the last few days for folks who qualify under 1A and 1B. We had new appointments put online this morning at 10 a.m. I think within 8 minutes, those slots were taken up. Again, we've been strategically targeting members of the Office of Persons with Developmental Disabilities, as the state has asked us to. We specifically have worked with teachers' unions and school districts this past week as well to try to figure out how many people are still out there that want a shot that don't have an appointment. We're making up very good ground there, and maybe even we'll have a good idea of how many people we have left in these in our education group. Maybe we can even get to most of them by the end of next week potentially. We've worked with law enforcement bargaining units in different departments, and again, we'll go back out, reach out to them as well, but we think we've saturated those groups. Certainly, at any point, people can change their mind. If they didn't want to get the shot, later on in the process, you qualify, you can get the shot. But we're making up ground there. That's important because that allows us to focus in on our immunocompromised moving forward. There's been 2 categories that have made up hospital beds, predominantly ICU beds, and loss of life. They have been our seniors, and they have been the residents in our community who are immunocompromised, often both seniors who have comorbidities when we look at our 649 neighbors we've lost. So when we have discretion in our pod, we're going to use that discretion to try to get to the most vulnerable of the vulnerable. And that's been our strategy. We've been very transparent with that. As we move forward with this week and next week, and if we can get into a place where we're comfortable that some of these other 1B groups have been saturated, maybe then at our pod we'll open it up to potentially restaurant workers once we're comfortable with the data. Restaurant workers can go to the state site right now and get an appointment. We've not allowed that at our pod yet, again, because we're micro-targeting the most vulnerable. But once we get more comfortable with data, again, we may pivot on that as we move forward. To date, we have administered 18,734 first doses at our pod, 12,593 second doses. Overall, in Onondaga County, we've had over 62,000 first shots. I'll get a specific number for Thursday, but we're doing pretty well. We're outpacing the state average related to vaccine percentages based off of population and based off of eligible population. We're doing very well with that. Reminder for people that right now our biggest risk of seeing spikes are obviously gatherings where people aren't taking proper precautions, but also it's symptomatic spread. So please, if you have symptoms, we need you to get tested. Rule out COVID before you move on with your daily lives. Once you know you don't have COVID, then you can move forward from that point. Symptomatic testing at the F-Shed is Monday through Friday, 9 to 2. On weekends, it is at an Essentia Health from 8 a.m. to noon. Again, the website for this, ongov.net/Cayuga Medical. We have our community testing, our rapid testing, asymptomatic rapid testing in the community at sites. Today we are at the Northeast Community Center in the city of Syracuse, and we're also at the Cicero American Legion. Wednesday, we are at the Fayetteville Village Hall, as well as the Town of Clay Senior Center. Thursday, Onondaga Town Hall and Lafayette Community Center. Normally we'd be testing in schools this week as well, but obviously there's a winter break, so we won't be doing that. Related to our landlord survey we put up on our website last week, in the last stimulus package at the end of 2020, we received over $13 million for assistance for tenants who have been victims of COVID pandemic, who've fallen behind on rent. This is good for our tenants. It's good for landlords. We're trying to tailor this program so it's most effective. We ask that you go to ongov.net, fill out the survey. We're going to have the survey there for landlords until February 26th. At that point, we're going to finalize our program and start getting the money out the door so that we can prevent evictions, help these landlords who've been going a long period of time without getting any income, and overall be good for the region. But we need people to fill out that survey online. And saying that, happy to take questions.
Ryan, you mentioned the appointments went this morning in about 8 minutes.
Correct.
How many? 1,000?
Yeah, so what we did this week, Jim, is we have 1,900 total shots coming in. I believe they'll be here hopefully later this afternoon. There's some weather that may be slowing it up. We've worked with 700 of those, 900 of the 1,900 will be for a separate clinic on Friday, of which we will be working with OPWDD and the primary care physicians' offices that have been participating with us in identifying essentially the most vulnerable of the vulnerable. So that's a Friday clinic. Wednesday's clinic, tomorrow's clinic, we put essentially 500 slots online, maybe a little more than 500, that went in 8 minutes. We had over 200 slots dedicated to educators and then on list as well. So essentially there will be 1,000 new appointments for Wednesday, and then there will be 900 new appointments on Friday.
How many
The on list, 200 names from on list.
280?
200.
Oh, 200.
200 from on list. Looks like 200 educators, plus 500 appointments. There's a gap of 100, so it may be 250 and 250 is what it ended up being, as people are shaking their head in the back. I see doubles, so I see two heads shaking in the back. I'm assuming that's Ann Rooney. It's two heads that are shaking in the back.
250 and 250?
Correct.
Okay. Have you been briefed on the maskless party among athletes at Syracuse University?
I haven't. I've read it. My understanding is it wasn't an in-season sports team. Just not smart, right? Let's put things in context. Normally, would I be surprised if there's a party at Syracuse University? No, I would not be surprised. In the pandemic, we're going to have to continue to remind everyone that that's the type of behavior that can lead to many, many cases. And the direct result is a pause in in-person learning. So the direct result, if you're a student athlete, is that your ability to have your college experience will be paused for a period of time. There is real consequences, let alone some of the consequences I think that have been reported about Cortland and others. So we need to be better. It's a great opportunity for leadership for all of our young people. If you're a student athlete, you've been preached this quite a bit. And so certainly this isn't news. And you really should be held to a higher standard, in my opinion.
So 75 new cases in 24 hours seems like a relatively decent number, considering the spike we're still coming off of. But you said a lot of new cases are being attributed to colleges. So has that percentage of new cases gone up?
Yeah, I mean, I didn't see how many of these came from colleges today, Andrew. I know that last week we had a couple days where we had, double digits at least 2 or 3 days in a row, right? So usually if you have one event that creates this outcome, you're going to have cases lagging from the one event. I haven't heard of the party where sports athletes hosted a party. I haven't heard of that caused any cases. I know some of the other ones did. But we just got to be smarter, right? And these, hopefully we're going to get through this process and the community is going to get vaccinated, and late spring, maybe these student athletes and students will still be in college, and things may be a little different. But until we get there, it is what it is.
So the one maskless party isn't the only party. There have been others that have led.
Yeah, I think the ones that we know that led to other cases were the ones that were involved with the Greek chapters. We know that. I haven't heard if this party drove cases or not, but any gathering, whether it's at a party on the Hill or a party in somebody's living room, represents greater risk in these circumstances. Especially, these are winter months. These are months where the virus is going to do well and perform well, regardless of our human behavior. So we need to be even better.
County Executive, it seems like every step of this approval process, you've learned something about this different approval process. So for this new kind of pre-existing conditions system, what has the county learned to kind of streamline this system for future?
Yeah, we'll learn more, right? So we're getting into this. I think the one thing we've learned is that right now it's still about speed, right? So everything's about speed, shots in arms. The faster you get shots in arms, the faster folks get immunity. So breaking down the distribution, making the distribution network more complicated right now is not something that we can support. And so I think that's a little bit, when you get into the immunocompromised category, it makes people a little nervous because a lot of these folks haven't gone out of their house. They're more comfortable going somewhere, whether it's the doctor's office or not. So that's a balance we have to make, right? A decision we have to make, that speed. It's important we get to as many people as quickly as we can, and we don't break that process down. But we'll go through this, right? This is our first week with the immunocompromised residents that are under 65 and a focus. But we'll pick up on things, and then we'll improve on it. Certainly there's going to be hiccups. Every part of the process there's hiccups.
Have the doctors had I'm wondering how the doctors have been in terms of establishing among their patients who they should refer for your allotment. I'm wondering what their read is on that situation.
Yeah, a couple of them were vocal, right? And didn't want to pick, right? So that's fine. That's why, what some of them, I don't know what the other groups did and how they did. We asked them to look at those who had multiple conditions. And I receive emails all the time, and specifically from those who have comorbidities. This whole process that they've been waiting, literally with people saying, I can't go do this because the doctor tells me if I get COVID, I will die. I get those emails. Those are gut-wrenching emails. In my mind, I know there's lots of people in that boat. Those are who the doctors should be picking. That's an easy call, right? Picking somebody there. Then we'll get to everybody, but your 25-year-old that may have a condition compared to somebody in that boat, those are, to me, it's an easier call to make. And I think there's primary care providers who've been working with Dr. Gupta to get it done. I think there'll be at least 700 of those residents and those doctors' patients getting shots this week, as well as out of our other supply. There's many others who have comorbidities that are going to get vaccinated, and there's many others who scheduled appointments at the fairgrounds as well. So overall, it's going to be a good week with the vaccine.
900, you said, for that clinic?
Yeah, there'll be 900 on Friday's clinic of pre-registered individuals, including the 700 from being referred in through the primary care physicians network.
And the 200 extra?
Are from the Office of Persons with Developmental Disabilities.
Ryan, when it comes to kind of doing things in groups, lacrosse games, concerts, it sounds like the state right now is making PCR testing a requirement of that. How much capacity do we have here to do asymptomatic PCR testing?
Yeah, so our asymptomatic tests and the tests on the marketplace that we've looked at are antigen tests. So I think for Syracuse University, they have their own PCR test and lab. They're going to be better positioned to figure out a business model for their events. The PCR testing model for other events is going to be a challenge. And so I understand that many of the health professionals like the PCR test better. They think it's more accurate. But when you think of an amphitheater season, I think a model of vaccination and then a rapid test is probably a better model, better business model than the PCR model. The PCR tests a couple things. One, insurance doesn't cover it. So you're looking at, unless you're symptomatic, right? And if you're symptomatic, you're not coming to a show anyways. And so that's a tough model. So out-of-pocket costs will be higher. Now, people will probably be willing to pay that out-of-pocket cost for the experience after you haven't had one in a year or so, right?
You know what it is? Kind of the out-of-pocket?
Anywhere between $50 and $150 probably. So a rapid test like what we do, or some of the newer rapid antigen tests that are coming out, are cheaper. They're more available. So I think a vaccination, if you got your vaccine and then you take a test, whether it's PCR or antigen, I think that makes sense to me. I do think the model of a PCR test within 72 hours is going to be a challenge because you don't control the turn times with those labs as well. And you're going to have a situation where insurance isn't going to cover it all the time. So how it breaks out, how well the program works, we'll see.
Is there any movement, and I know it's months away, right? We're months away from the concert season, with the governor to kind of get that shifted to a antigen?
Yeah, we talked about it, right? We obviously are a stakeholder. We have an amphitheater. We want to have a season. We want to do it safely. It's an outdoor venue on a lake, right, with a nice breeze. So we think there's ways to do it. They're learning, right? They did a couple football games. They're going to start doing indoor basketball games and other events. They'll learn from it. I'm just pointing out the obvious flaws in it. Again, at 5 or 10% capacity, can you find somebody willing to pay for the PCR test out of pocket, probably right now. If you have people, our season's later in the year, so September, October, maybe even just August, September, October. By then, we know, according to the president, his team's briefings, that there will be enough vaccine for every human being in the country. So I think vaccination plus asymptomatic test is a pretty good policy at that point, and we'll continue to make our voice heard on this.
We've talked about Syracuse lacrosse and the general public.
Mm.
Is your understanding that they're hoping to get to a point where they would bring the general public to use their labs in order to get people?
I think they can, right? I think they're in the best position out of anybody. If you had, for example, I talked about, well, what about the War Memorial? I got the Syracuse Crunch. Rochester Amherst are allowed to play because they got 10,000 fans in their stadium. I think we're at 7,000 or 8,000. We're not a small arena, but we're not a huge one either. So I'm asking the state, give me guidance on the Crunch. So how would the Crunch set up the PCR component of that? We don't have a lab in the Onondaga County. So they're going to have to go figure that out for it to make sense for their fans, so they could have some fans there if they're allowed. Syracuse University has their own lab, so they have more tools available to bring it to the general public. And maybe the general public uses their lab. Maybe it doesn't, but they have more tools to get it done.
So forgive my ignorance. I don't even know where I would go to get an asymptomatic PCR test. Is that pharmacies? Do you have to go to your...
No, so a PCR test is essentially a symptomatic test, right? It's either saliva or a nasal swab. So the saliva is what I prefer. I had the nasal swab recently. It was a little uncomfortable, but that's what you would have to go with that test. So Syracuse University can do both. Obviously, Upstate does the saliva test. Could a Syracuse Crunch partner with Upstate somehow? Yes. There will be a cost to that. Who then pays for it? Does the ticket holder pay for it? And then does that model work for an extended period of time? Time would tell.
Ryan, did you say the athletes who were involved in that S3 party were not part of an in-season team?
It's my understanding.
So that would mean not on the basketball team?
That's my understanding. Now, I may be wrong, but that's my understanding, is that this was not any in-season athletes.
I was wondering if you had a response. I know you've already responded a few days ago to the AG's report, but I was wondering if you had a response to the governor's comments yesterday, kind of for the first time responding and saying what he'd wish he'd done differently.
Yeah, I think it's important that when we're in these roles, I think to your question earlier, there's so much information coming at you and you make decisions. And I think it's just important at all levels of government. We're completely transparent and we communicate, even when the communication is news that we're not happy about. And so I think it's important that those of us in these roles, in these unique roles at this unique moment in history, continue to do that. And I think I saw some of his briefing yesterday. I think he went through and answered the questions he thought needed to be answered. It's up to all of you and the public at large to feel if he answered the questions the right way. I know that I've lived through some of this process, and I know that we tried to do things and at every step of the way that we thought were going to promote the public health and try to prevent the loss of life, including with nursing homes very early on. And I know that when we were trying to have nursing homes tested, we were told to stay in our lane, but it wasn't just by the state of New York Department of Health, it was by the nursing homes themselves. So I think living through all of this, it's tough to go back and explain context last March when we're almost in March of 2021, but we're all going to be held accountable for the decisions we've made, whether they're good, bad, or indifferent.
To that point, the county got out of the nursing home business a while ago.
Mm-hmm.
What were some of the decisions that led up to that? And, and I guess what are the kind of choices that led up to that? And I'm sure you're very pleased today that.
Yeah, we've thought about this when we reflect on what happened, because there are county-run facilities, to your point, that you had county executives in positions to deal with some of these regs, and some agreed to implement them, some of them didn't. We used to be the owner and operator of Van Dyne. The nursing home business, to be government run, I believe the reimbursement rates when we got out of the business in 2012 or 13 were at like 1981 levels, right? So they clearly, when you look at the funding from Albany at the time, they were telling us indirectly that they didn't want us in that business because they weren't keeping up on par. So it was a fiscal decision and a quality of care decision, quite frankly, for us to not be in that business anymore. And so we got out of that business, I think, in 13, Ann? Then we got out of it? I was the chairman of the legislature, and Ann was working in the role. She was heading that effort. So it was a good decision then. I think it was a good decision overall. We had a lot going on with the pandemic. Having that challenge of operating that facility, making real-time calls would have been difficult as well. So I think overall it was good that we made the decision back in 13 to get out of that business.
Have any county departments been impacted by COVID diagnoses?
You mean cases?
Yeah.
Oh, yeah. I mean, we're just like any other operation. We've had people who've tested positive for the virus. One of the things we did is we've had a lot of departments working from home when all possible to de-densify, and that's been something that we did initially. We brought back people during the summer as things got better, and then when things went into the second wave, we put people and allow them to work remotely again. But we, like any department, we've had, probably every one of our departments has had COVID cases, and it's just like any other organization.
What's the burden right now that you're most worried about on the county? Is it the sustained testing that's still happening but not getting as much attention? Is it vaccinating people? Where are all the resources going, and where have things eased up, and where are things still a big challenge?
Yeah, I think overall the immediate task at hand, Andrew, is to make sure that the second we get that vaccine supply and it gets better, is that we get it in arms. So that infrastructure has been built up. We need to continue to do everything else we do related to COVID to keep numbers where they've been going. One of the things that we're going to get a really good sense as a community in 12 to 24 months from now is the ongoing impacts of this pandemic on our most vulnerable, on our kids, on families, what happens to poverty rates, these types of things. We've seen the impacts related to opioids and suicide rates, things that when you can't have people together or they're limited, there's a real cost to that. So we're going to get out of this crisis at some point in 2021 with vaccinations, but then we're still going to be dealing with the after effects and the impacts, I think, for years to come. And so I think we transition to the immediate public health crisis, and then we transition to what rebuilding looks like. And that's not just from economic stimulus, it's the fabric of the community has to rebuild again.
We haven't talked about sales tax in a while. Obviously, the payments are down from 2 years ago. I'm thinking there's a year started to not be a fair comparison, right? Because they were probably worse last March than they will be this March. But where do you stand on sustaining the budget you passed this year and compared to previous budgets?
Yeah, so we're starting to get payments in for 21. And so the first payment was tough because the state took out a distressed hospital fund payment from us, a large payment, $3 million that they passed in the 2020 budget. That came out of our first payment. So we're kind of guessing what that first payment really looks like. We'll continue to start getting more payments comparing. look, we're going to have a 2-year, a 2020, 2021 revenue loss of just revenue over $60 million. There's no question. If we're allowed to carry that over on what would have been the trajectory we were at pre-pandemic into the third year, it gets even larger. And then that doesn't, you have your room tax, you have your property tax collections, all these things that get included with that. You have state cuts. So we made a lot of tough decisions in the 2020 budget year that probably will have saved us as our books get completed for 2020. They've been painful. 2021, we made a lot of tough decisions. Whereas if we get a couple things going right, we might be able to do some things differently. Other municipalities didn't make the tough decisions, and they've waited and waited hoping for help. We're in a position now, if we get help, that will help us do things differently. But the pandemic has hurt, and it's hurt us. If we get federal help, we'll be in a position where we can do things to stimulate. We can go and strategically make investments again in people and in infrastructure, and hopefully that help comes in the near future.
Have you talked to the congressman about Joe Biden's plan that does include direct aid to Onondaga County?
Yeah. So I've talked to Senator Schumer, Congressman Katko, Senator Gillibrand's team. We've had talks. What we don't need to have happen, and this is what happens in Washington, right? So, is everybody agrees on 90% of the bill, but then a poison pill gets put in, something that intentionally you put in so that the other party can't vote for a bill. Both parties do it. It happens all the time. Hopefully that stays out of this stimulus package. Onondaga County would do well. $90 million over 2 years. Does that cover all of our losses? Probably not, but it's a lot better than nothing. So I certainly, the congressman knows that. Senator Schumer has been such a great champion, really helping shepherd this through, especially with direct aid to Onondaga County. The only way we get any money is if it comes directly to us. We've been through the CARES Act, right? We were owed $80 million. It didn't come to us, and because it didn't come to us, we didn't see it. So Senator Schumer's really been a great champion for pushing direct aid to localities. Other questions? Okay, so we'll be back on Thursday. Thursday, I hope to have comprehensive data on our pod related to demographic breakdowns, and then hopefully macro data related to county residents on who's been vaccinated. But